Hello, dear students and esteemed learners. Welcome back. Welcome to my course on Sociology of Health. This is lecture number 48, and in this topic, in this lecture, we will talk about health of elderly population, global and Indian scenario. So, as you know, this week we are talking about health of children and vulnerable groups. So, as I talked about this topic in the first lecture for this week. Basically, uh, there are vulnerable groups. Vulnerable in the sense that because of their specific location in the larger social, political, cultural, and economic context, they have susceptibility related to multiple types of problems, and because of those things they become vulnerable, and so we identify them as vulnerable groups. Sometimes they are also identified as marginalized groups or deprived groups, but very often the term vulnerable group is also used for that because of the kind of vulnerability that they are having, right? So one of the very important vulnerable group from the perspective of healthcare is the elderly group, irrespective of their socio-economic or political or cultural context. Aging very often makes them vulnerable to several types of health related problems, and of course other problems also. So, we will try to understand the health related issues of the elderly in this lecture, and we'll try to understand the problem at the global level as well as in the Indian context also. There are good number of concepts that I have included in this lecture because all these are interrelated, and for having a fair understanding of the topic we need to understand these concepts also, because health related issues of the elderly are sometimes very specific, but sometimes basically those are the extension of the other problems existing at the level of the society or at the level of the healthcare institutions and several other similar institutions and domains. So, for having a comprehensive understanding, we need to understand all related aspects. It will not be possible for us to talk about all these possible dimensions in one lecture, but I have tried to introduce the concept so that anybody who is interested in knowing the things at a length can explore the things in those directions also. So that is the logic behind including all these concepts here. We will begin with the very important intervention at global level, the United Nations Decade of Healthy Aging. So 2021 to 2030 is marked as the United Nations Decade of Healthy Aging, right? So that signifies the importance of the problem, because 10 years have been marked. The entire decade is marked with the problem of healthy aging. The United Nations Decade of Healthy Aging is a global collaboration aligned with the Sustainable Development Goals to improve the lives of older people, their families, and the communities in which they live. So, this is a global collaboration. It will continue for next 6 years. It was started in 2021 itself, and the World Health Organization is basically the leader of this collaboration. Now, when we talk about the problem of elderly, then very often we get to know about these two very important terms. One is gerontology and another is geriatrics. We need to understand these two terms also, because this is very often overlapping with the problems of healthy aging or the problems of elderly people. Gerontology is the study of the social, cultural, psychological, cognitive, and biological aspects of aging. So, aging is actually a process. Just after taking birth, the age is increasing, and along with that increase, the process of aging is initiated. Now, at certain level, with aging, the body and the mind and all related component basically move towards maturity, and that is considered as basically growth and progress, and we all appreciate that. However, after reaching to certain stage, depending upon the kind of background the person is basically having and the kind of the social environment in which he or she is living, there are good number of things happening which are basically not necessarily biological, but which could be psychological, cultural, social, and then related to several other dimensions, which create some kind of negative impact in the body and the mind of the person. And we all know that all humans are basically mortal. So mortality is an inevitable situation. So very often we link the kind of deterioration which is coming in the body and the mind and the functioning and the several organs, very often that is actually related with the kind of the ultimate reality of our life. So in day to day use, very often aging is seen from that perspective also. So although the technical definition of aging as given by the medical scientist or biologist would be different, but in common parlance, aging is considered like a stage in which the weakening of the person is basically beginning. But is there any specific age for that? That will vary from culture to culture, from society to society, from person to person, because across the cultures we can find multiple types of trends and patterns. So gerontology is basically a detailed study of all these things, and this is multidisciplinary because it engages biology, nursing, medicine, social work, psychology, psychiatry, sociology, economics, and good number of medical as well as social sciences. On the other hand, geriatrics is basically a specialist branch of medicine, and it specializes in the treatment of existing disease in older adults. So, geriatrics talks about the kind of disease which are prevailing among the elderly or older age people, and very often those are basically interconnected and complex because those are related to the functioning of multiple organs. So, a kind of specialization is often required to handle the problems when the person is basically has reached to a specific age group, which is generally identified as 60 years, because the problems are basically interrelated and interconnected. So geriatrics is basically providing medical services to the aged population based on the kind of disease that they are having, whereas gerontology is a very larger phenomenon which talks about the aging process and then all different types of factors associated with that. Now, what is the issues related to aging? in the world, contemporary world, as of now. If you try to understand this, then we need to take support from the information provided by World Health Organization in its websites. So a good number of information is taken from World Health Organization's website, and these are basically open access. I have provided the link also. If you want to uh, explore more, you can go and check. People worldwide are living longer and life expectancy is increasing. Today, most people can expect to live into their 60s and beyond. Every country in the world is experiencing growth both in size and proportion of older person. So there is very encouraging statistics that life expectancy is increasing. People are living longer, and with this, the proportion of people who come under the 60 plus age is also increasing. And this basically, the 60 plus population is very often identified as the elderly population, depending upon the specific context and the way the governments have been identifying that. Now, this proportion and this number both is increasing, and it will increase. And so, people make different types of projections. By 2030, 1 in 6 people in the world will be aged 60 years or over. At this time, the share of the population aged 60 years and over will increase from 1 billion in 2022 to 1.4 billion. That means the number will keep on increasing, and so there is need of having a specific kind of concern for the situations related to this particular social category. While this shift in distribution of a country's population towards old ages, known as population aging, started in high income countries. For example, in Japan, 30% of the population is already over 60 years old. It is now low and middle income countries that are experiencing the greatest change. So there are different types of patterns. Uh, First, the developed countries basically witness the increase in life expectancy, and so the category which is generally identified as the elderly category. But now that kind of development is taking place in almost all other countries. So even those countries which are socioeconomically not that developed, they are also having that kind of experiences, and uh, that is why it is projected that the time to come, the population of this specific age group will increase, and it will be a very heterogeneous kind of population. So what would be the possible challenges? That is one important thing. And what are the existing challenges? That is another important thing. And the second is more important as of now, but the first, that is what would be the situation, is also important, because when we look at the things from a sustainable development perspective, then we need to take care of the future situations also, right? And as we see, as we just mentioned, that there is a collaboration between United Nations agencies and WHO, and basically there is an alignment with the sustainable development goals. So sustainable development goal basically gives us the insight to think of the future also, because that is very important. We need to make the important interventions now, so that we can have a secured future. So these are the concerns that basically make us to understand this very important topic. Now, what are the common health conditions basically, or the common health problems when we think of the population which is identified as the aging population? So common health conditions in older age include hearing loss, cataracts, then refractive errors, then back and neck pain and osteoarthritis, then chronic obstructive pulmonary disease, diabetes, depression, dementia, and several others. These are few which have been identified by World Health Organization, and I have included only some because we cannot talk about all the problems. We just need to get an idea. So older age is also characterized by the emergence of several complex health states, commonly called commonly identified as the geriatric syndrome. So we talked about the geriatric uh, issue earlier also, because these are the complex health states which are very interrelated actually. So for that actually we need experts, and geriatrics is basically a kind of a medical expertise that tries to handle the equilibrium kind of situation or the balance kind of situation. They are often the consequences of multiple underlying factors and include frailty, urinary incontinence, then falls, delirium, and pressure ulcers. And these are the medical terms, but in day to day use, we can talk about several other situations which are prevailing, because this is something which is happening at the level of almost every household. We have seen our grandparents growing old, and parents growing old, and many among you might have seen or seeing your grandparents getting old, right? So this is a phenomenon which is actually present in every household, and that way it is touching each of us, just like the problems related with the childhood or reproduction is related to each and every individual. So similarly the problem related to aging and elderly is also related with uh, every household. Now, what are the challenges related to population aging? There is no typical older person. World Health Organization has categorically mentioned this, and I have taken this statement from its website, right? Because identifying someone as an old person is not depending upon the kind of specific variable. Some 80 years olds have physical and mental capacities similar to many 30-year-olds. Other people experience significant decline in capacities at much younger ages. So, age as such, very often it is stated that age is just a number. It depends upon the kind of health situation and the kind of quality of life and the kind of fitness level that the person is maintaining. So very often an 80-year-old person may find himself and herself very fit in comparison to someone who is in his or her 30s or 40s, right? So that is again a very important thing. The diversity seen in older age is not random. A large part arises from people's physical and social environment and the impact of these environments on their opportunities and health behavior. So, the larger thing is the environment in which basically we all are living, and not only the physical environment we are talking about, basically, the kind of social environment that we all are living in, because that is what defines the kind of life that we are having, and that is what will decide the kind of life people will lead. And when we are talking about health basically, then we should remember here that WHO has defined health as basically a condition of wellness where the physical, social, mental, and spiritual wellness is basically in alignment. So it is depending upon a good number of variables, right? It's not just the age which is deciding that. Age is only one such factor. And one very important thing basically that we are witnessing increasingly globally is the problems related to inequalities. When inequalities are prevailing, then that is getting reflected in the health outcome also. And when people are not enjoying good health in their childhood, adolescence, or when they are adult, then certainly the situation is going to be even more problematic or complicated when those people basically reach to their 60 plus age group. So this is a serious kind of situation or challenge. So if you want to take care of the healthy aging, then we need to take care of the health issues of the population in every age group. Unless we have that kind of approach, we cannot address the problems which which may come into existence or which are coming into existence in the older age group, right? So there are serious challenges. And then when we talk about the kind of quality of life that people are having, or the kind of income related inequalities that people are witnessing, or the kind of social environment, and issues like social harmony and social inclusion are very important, because these are related with the social health and the psychological health or the mental health. So if people are not enjoying good social health or mental health, then that is bound to create challenges for the physical health also, because there is interdependence, there is interrelatedness. That means when we are talking about population aging, then we need to take care of the kind of society basically we are living in, how democratic the society is, how participatory the society is, to what extent there is basically the freedom of choice, right? And so you may remember when we were talking about reproductive health, then the ICPD conference basically talked about empowerment of women and the freedom of choice basically, right? So if we are talking about reproductive health and we are talking about the freedom of choice, then certainly that approach is applicable when we are talking about the problems related to healthy aging also, because that is the age group when people are becoming even more vulnerable. So if we talk about the aging of the women, then if patriarchy is creating a problem at such an early stage, then this will create even more problems when people reach to that older age group. So these type of situations are actually prevailing, and these are actually complicating the things. So we need to understand the situation from that perspective also. And one important concept that I would like to talk here is related to palliative care, that is often confused with the problems of elderly. Actually, it is defined differently. Palliative care is an approach that improves the quality of life of patients, adults, and children and their families who are facing problems associated with life threatening illness. So, very often there are diseases which are life threatening, which are sometimes considered as incurable, and the people are suffering from those diseases, and they have or they are suffering from pain. So this palliative care is talking about giving a relief to people and their family, so that they can have some kind of comfort in the remaining life or the rest of the life. So this is basically the concept of palliative care. Yes, of course, that is also applicable in case of old age people, because people may have some types of serious age serious disease or serious complications. But some of the important diseases basically which are generally identified with the issue of palliative care are actually related to some cardiovascular problems or some extreme stages of diabetes, or problems related to cancer or AIDS, or some of the respiratory disease, because very often these problems create that kind of complication that it is becoming almost irrecoverable from the perspective of medical science. So in those situations, palliative care is coming into picture. Now we need to talk about the situation related to elderly in Indian context. So the elderly population aged 60 years or above in India accounted for 7.4% of the total population in 2001, and it increased to 8.6% of total population as per census 2011. So between 2001 to 2011, there is increase from 7.4% to 8.6%. Most common disability among the aged person was locomotor disability, visual disability as per census 2011, then prevalence of heart disease among elderly population was much higher in urban areas than in rural parts. So basically, the census is giving us the basic demographic details related to the problem of aged also, just like the people coming from different age groups. Census is the source of most authentic data. The 2021 census is got delayed because of COVID, so we do not have the updated information, but very soon we will get information on that also. So here I have given the composition basically of the rural and urban population and the elderly population basically. So we get an idea that as of now, the 8.6% of the population is identified as the elderly population. This number is actually increasing, and certainly it will increase because life expectancy is improving in India. Now, I don't have the data about the states as of now, but I think if you are interested in knowing that, then you can explore the census data. Now, what are the various programs basically? As we discussed earlier, that this is a this is something, this is a phenomenon which is related to almost every aspect of our social, economic, political, and cultural life. Almost every aspect is having some kind of say in this, and so it will be very difficult for the government to have one focused program which can address all these problems, right? But still there are few programs. National program for health care of the elderly. The Ministry of Health and Family Welfare launched the national program for health care of elderly during the year 2010-11 in the 11th plan period to address the various health related problems. So when we are talking about the elderly group, then they are having multiple problems or multiple situations, some of which are identified as problems, but the typical health related problems are the things that we are actually interested in as of now more particularly. And so this program is trying to address some of the medical problems, all the health related problems. And then a larger strategy is actually required to address those problems, right? So we have a very comprehensive strategy for securing the healthcare of the elderly people, and that is based on 5 components. And basically these components are well known to us because these are applicable in different age groups, so these are also applicable in the elderly group also. But yes, at this stage these are more applicable. And preventive and promotive care, yes, the negative consequences of not having a careful or cautious or a systematic or scientific approach towards health are more visible during the older age group. Because if we are not taking care of our health during our adolescent stage or adult stage, then the problems may start, but those are not manifesting as of now. But when we reach to the older age, then those problems basically start to dominate. So if we want to take care of the health issues at an older stage, then the preventive and promotive care need to be taken care of much earlier. This preventive and promotive care will not come into force after reaching to that older age, but much earlier. So this is basically a very important component of this strategy. And then management of illness is of course very important, because once the person is basically inflicted with the problem, then that should be managed appropriately, and all health structure could be very helpful in that. Then manpower development for the geriatric services. Geriatric services we have been talking about, and that is basically challenging because that needs a very comprehensive understanding. So that is a specialization which needs several other types of specialization, and so this expertise should be strengthened, and the available health personnel for this service should be increased to take care of the needs as of now and the future needs also. Then medical rehabilitation and therapeutic intervention, yes, of course, this is very much required. This is the stage where rehabilitation is becoming more important. And then information, education and communication, these are important at every stage, and so more applicable at this stage also. Then we can conclude the whole topic by talking about basically a larger framework where multiple agencies have their role to play. So basically, we need national policies. One specific policy for old persons will not serve the purpose. Basically, we need to adopt the kind of approach in which we say health in all, because there are issues related to the finances, there are issues related to employment, there are issues related with social security, there are issues related with safety, there are issues related with uh, inclusion, insurance, and all these things basically need to be taken care of. That means in each and every aspect of social or public life that basically we are having, we need to specify the specific approach for taking care of the population when the population is reaching to the category of aging population. And so basically we need to have the sustainability approach in almost every walk of life, because only after having a sustainability approach in different walks of and domains of life, we can think of providing good living condition for the elderly population. And two or three things are actually very important here. One is the family care, because the problem of isolation is becoming very important in this age group. Then social inclusion is very important. And then basically work is very important. There is a book, basically Ikigai, becoming very popular these days. Anybody interested in understanding this issue can go through this book, Ikigai, because that talks about the Japanese experience of the elderly people. And one very important thing which is mentioned in that book is this, that people prefer to work even during older age. So work is the source of keeping people healthy and happy. But yes, that should be based on the freedom of choice, right? So the larger concern is not only focusing on making improvement in the medical care, but also on making an environment in which the social, emotional, and all other needs are taken care of. So this is all that we could have included in this very important topic. Uh, if you are finding this topic interesting, then you can refer to some of the documents that we have mentioned here. Yes, of course. And then I have added one paper here also, which is available in an open access domain. So you can go and read the things at length there also. So this is the think about this problem and activity question. So try to address these things also. And with this, we conclude this topic. So thank you very much for being with me. And then we will meet in the next lecture, and take care.